Hello friends, today I would like to talk to you about blood pressure and exactly why. Because blood pressure is a very important risk factor for cardiovascular disease, and it's important to understand how to really measure your blood pressure. For that, we need to look into the three types of blood pressure monitors that are available. There is a mercury column, as you can see, an aneroid, and a digital. The aneroid and the digital monitors are the most commonly used at the home level because the mercury one is usually used at the healthcare professional or the doctor's clinic. Now, when you're choosing a blood pressure machine, it's most important to remember to choose the right one that works for you and for the environment. You should avoid any wrist and finger monitors because they may not be very accurate. You should also choose validated monitors. If you're unsure, then please get it calibrated by a healthcare professional and then you start using it and you understand how exactly to use it by visiting your healthcare professional. Before choosing the blood pressure monitor, even in elderly, pregnant women or children, it has to be validated for that particular person. You can measure the blood pressure around the upper arm, which is usually where the cuff is placed, and choose a monitor that will come with the correct cuff size. Remember, there are various cuff sizes that are available. The blood pressure can be measured around the upper arm, as we know that we use a cuff to measure the blood pressure. And you can choose a monitor that comes with a cuff, which is your particular upper arm size. So please ask for the right size of the cuff, otherwise the readings can be erroneous. When you're measuring the blood pressure, it is important to follow certain guidelines. It is advisable to be measuring the blood pressure on an empty bladder so that you avoid inaccurate readings because of sometimes water retention. You do not smoke within 30 minutes or drink caffeinated beverages within 60 minutes because it could affect the blood pressure due to the caffeine. You should remember not to talk or eat while taking a reading, or at least wait for 10 to 15 minutes after bathing or showering before taking your blood pressure. The room temperature also should be ambient because if it's very warm, it could raise your blood pressure. You relax on a chair next to a table for about 3 to 5 minutes, sitting upright and straight against the chair, legs uncrossed and feet flat on the floor. You rest the forearm on the table with the palm of the hand facing up. Wear comfortable clothing because you have full sleeves and you have to roll up the sleeves because otherwise you'll get an erroneous reading again. Properly fit the cuff on the arm. That is very important. It should be snug and not very tight because it should not restrict the blood flow while that cuff is expanding. You take two readings at least 2 minutes apart to ensure accuracy, and also you will know that they are not very erroneous or it's not far apart. Then it's almost like taking an average of your readings. You have to check the batteries routinely for the electronic monitors and store extra batteries according to the instructions. You can compare the results and discuss your concern or if there's any inconsistency in the readings with the primary healthcare provider so that you know it's not an error of the particular instrument. You check the blood pressure monitor at least once every year to ensure that the monitor is working properly. As a patient or a healthcare giver to somebody in the family who is taking antihypertensive medication, it is important to measure the blood pressure at the same time in the day, or it also sometimes may be recommended at different times in the day depending on what the healthcare provider or the doctor advises. Thank you for listening in, and do take care of your blood pressures because it is an extremely important risk factor to cardiovascular disease. Do not ignore it.